You know your dog's daily rhythms better than anyone. The morning stretch, the predictable nap spots, the exact second they ask for breakfast. When that comforting routine breaks down, it's often the first sign that something is wrong internally. The disruption usually begins at the water bowl. You'll notice your dog drinking with a new intensity, draining the bowl several times a day. This is polydipsia, and it's inextricably linked to polyuria, a massive increase in urination that often leads to sudden accidents in the house, even for a dog who has been house-trained for years. Soon, another behavior emerges, polyphagia, or an insatiable appetite. A dog that once grazed might start inhaling their meals, constantly begging or anxiously pacing the kitchen for more food. But there is a contradiction in their appearance. Despite consuming significantly more calories, your dog starts losing weight. You can feel their ribs and spine more prominently every week. This specific pattern, a dog doubling their caloric intake while physically wasting away, signals a systemic breakdown. It indicates that the food they are consuming is no longer reaching their tissues. As the condition progresses, the body's energy deficit deepens. Your dog may develop a profound lethargy, showing little interest in their favorite walks or playtime. You may also notice physical changes in their eyes. A thick, milky cloudiness can develop almost overnight, indicating the rapid onset of diabetic cataracts. If the metabolism continues to destabilize, more critical signs appear. Breath that smells unusually sweet or like acetone, paired with sudden vomiting, indicates a metabolic emergency. These changes represent the physical toll of a metabolism that can no longer process its own fuel. Each symptom is a result of the body's internal systems struggling to maintain balance. To find the cause of this breakdown, we have to look toward the pancreas, a small organ located just under the stomach. In dogs, diabetes is almost exclusively type 1, meaning the pancreas has completely and permanently stopped producing the hormone insulin. Normally, blood glucose fuels every cell, but to enter, glucose needs insulin to unlock the cell's receptors. Without insulin, those cellular doors stay shut. Glucose gets trapped in the bloodstream, piling up to dangerous levels, while the cell interior actually starves. This explains why high blood sugar is so deceptive. The body is functionally starving, even while the bloodstream is saturated with energy. This cellular energy deficit explains the behaviors seen at home. The brain, sensing that the cells are empty, triggers the signal to eat more. But because that new food also cannot enter the cells without insulin, the body begins breaking down its own fat and muscle tissue for survival. The kidneys filter excess blood sugar into the urine. The sugar pulls massive amounts of water with it, causing constant urination and unquenchable thirst. Meanwhile, glucose enters the eye's lens, converting to sorbitol. This draws in water, swelling the lens until it turns cloudy white. Every behavioral change witnessed by an owner is a direct biological consequence of this cellular starvation and the buildup of sugar in the blood. While outward signs are helpful, a diagnosis requires clinical evidence. A veterinarian must confirm persistent hyperglycemia and glucosuria before treatment can begin. The first step involves blood glucose spot checks and curves. By measuring glucose levels over several hours, the vet can see the severity of the sugar overload and how long it persists. A urinalysis is used to confirm the presence of glucose in the urine and to check for ketones. These are acidic byproducts that appear when the body burns fat too quickly, which can lead to a fatal state called diabetic ketoacidosis. Veterinarians also use a fructosamine test. This provides a long-term view of the dog's average blood sugar over the previous few weeks, which helps confirm the chronic nature of the condition rather than a temporary spike. If a dog's symptoms do not resolve with standard treatment, veterinarians look for underlying issues. This flowchart shows the secondary diagnostic path, including abdominal imaging and hormone tests used to find concurrent diseases that can cause insulin resistance. The diagnostic phase is detailed, but once a routine of specific diet and daily insulin is established, the cellular starvation stops. With consistent management, a fatal crisis becomes a manageable condition, allowing your dog to return to a happy, active life.